Inflammation is a fundamental and intricate process that constitutes a vital aspect of the body's immune response. It involves a well-coordinated series of events that allow inflammatory cells, plasma proteins, such as complement, and fluid to exit blood vessels and enter the interstitial space. The process is categorized into two types, acute and chronic inflammation, each serving distinct purposes in defending the body against harmful agents and promoting tissue repair.
Acute inflammation is a rapid and immediate response that occurs when tissues are damaged or invaded by pathogens. It is characterized by the presence of edema, i.e. tissue swelling, and neutrophils, which are a type of white blood cell, at the site of injury or infection.
This acute response is a crucial part of the innate immune system and lacks specificity, acting as the first line of defense against a wide range of pathogens. Mediators of acute inflammation play pivotal roles in initiating and regulating the inflammatory cascade. Toll-like receptors, TLRs, are critical receptors present on various cells of the innate immune system, such as macrophages and dendritic cells. When activated by pathogen-associated molecular patterns, PAMPs, which are commonly shared by various microbes, TLRs initiate a signaling cascade that upregulates NF-kappa beta, a nuclear transcription factor that activates genes responsible for producing multiple immune mediators. Notably, TLRs also exist on cells of the adaptive immune system, including lymphocytes, underscoring their significant role in both acute and chronic inflammation. Another essential group of mediators in acute inflammation are the arachidonic acid, AA, metabolites.
Arachidonic acid is released from cell membranes by the enzyme phospholipase A2 and then metabolized by enzymes like cyclooxygenase and 5-lipoxygenase. These enzymes produce prostaglandins, PGs, and leukotrienes, LTs, respectively, which exert various effects on blood vessels and immune cells. Prostaglandins, such as PGI2, PGD2, and PGE2, mediate vasodilation and increased vascular permeability, allowing more blood and fluid to reach the site of injury. PGE2 is also involved in pain and fever, contributing to the characteristic symptoms of inflammation. On the other hand, leukotrienes, particularly LTB4, attract and activate neutrophils, facilitating their recruitment to the site of inflammation, while other leukotrienes, LTC4, LTD4, and LTE4, promote vasoconstriction, bronchospasm, and further vascular permeability.
Mast cells, widely distributed throughout connective tissue, are also crucial players in acute inflammation.
These cells can be activated by various stimuli, such as tissue trauma, complement proteins C3a and C5a, or cross-linking of cell surface Ig by antigens. Once activated, mast cells undergo degranulation, leading to the release of preformed histamine granules. Histamine, a potent vasodilator, acts on arterioles, causing them to relax and results in increased blood flow to the inflamed area. This increase in vascular permeability facilitates the movement of inflammatory cells and fluid from blood vessels into the interstitial space, contributing to the characteristic redness, warmth, and swelling seen in acute inflammation. Additionally, mast cells are involved in the production of arachidonic acid metabolites, including leukotrienes, which further amplify the inflammatory response. The complement system, a group of pro-inflammatory serum proteins, plays a multifaceted role in inflammation. Complement proteins circulate as inactive precursors and can be activated by various pathways, such as the classical pathway, alternative pathway, and mannose-binding lectin (MBL) pathway. Activation of the complement system leads to the production of several mediators, including anaphylatoxins C3a and C5a. These anaphylatoxins trigger mast cell degranulation, releasing histamine and other inflammatory mediators, and contribute to vasodilation and increased vascular permeability. C5a also acts as a potent chemoattractant for neutrophils, guiding them to the site of inflammation. Furthermore, complement activation leads to the formation of the membrane attack complex, MAC, which can lyse microbes by creating holes in their cell membranes, enhancing the body's ability to combat infection. Hagemann factor, also known as factor 12, is an inactive pro-inflammatory protein produced in the liver. Upon exposure to subendothelial or tissue collagen, Hagemann factor becomes activated and initiates a cascade of reactions, including activation of the coagulation and fibrinolytic systems, complement system, and the kinin system. The kinin system cleaves high molecular weight kininogen, HMWK, to form bradykinin, a potent vasodilator that also increases vascular permeability and causes pain. This cascade is essential in promoting a localized inflammatory response and facilitating the recruitment of immune cells to the site of injury or infection. The cardinal signs of inflammation, first described by the ancient Roman physician Celsus, are redness, rubor, warmth, calor, swelling, tumor, pain, dolor, and loss of function, functio lisa. These signs are a manifestation of the underlying inflammatory process and represent the body's efforts to restore homeostasis and repair damaged tissues. Redness, rubor, and warmth, calor, result from the process of vasodilation, whereby blood vessels near the inflamed area widen, allowing increased blood flow. Vasodilation is primarily mediated by histamine, prostaglandins, and bradykinin, which act on the smooth muscle cells in blood vessel walls, causing them to relax. This increased blood flow brings more immune cells and mediators to the site of inflammation, promoting the immune response and initiating tissue repair. Swelling, tumor, occurs due to the leakage of fluid from postcapillary venules into the surrounding tissues. This fluid, known as exudate, contains a variety of immune cells and proteins involved in the inflammatory process. Histamine and tissue damage contribute to contraction of endothelial cells and the disruption of endothelial cell barriers, respectively, allowing fluid to escape from the blood vessels and accumulate in the interstitial space.
Pain, dolor, is a result of the sensitization of sensory nerve endings by various inflammatory mediators, including bradykinin and prostaglandins.
These substances lower the threshold for nerve activation, making the nerves more sensitive to stimuli, leading to the sensation of pain. Pain serves as a protective mechanism, prompting individuals to protect the inflamed area from further damage.
Fever, another hallmark of inflammation, is an elevation of body temperature above the normal range.
It is often associated with infectious diseases and is triggered by the release of pyrogens, such as lipopolysaccharide, LPS, from bacteria. Pyrogens stimulate macrophages to release interleukin-1, IL-1, and tumor necrosis factor alpha, TNF-alpha, which, in turn, increase the activity of cyclooxygenase in the perivascular cells of the hypothalamus. The increased activity of cyclooxygenase leads to the production of prostaglandins, particularly prostaglandin E2, PGE2, which raises the temperature set point in the hypothalamus. As a result, the body perceives a lower temperature as feverish, leading to shivering and other physiological responses to increase body temperature. The arrival of neutrophils is a crucial event in the inflammatory process, as they are among the first immune cells to reach the site of injury or infection. Neutrophils go through a sequence of steps to reach the inflamed tissues. First, vasodilation slows blood flow in postcapillary venules, allowing cells to move from the center of the blood flow to the periphery in a process called margination. Then, selectin molecules, known as speed bumps, are upregulated on the endothelial cells lining the blood vessels. P-selectin is released from Weibel-Palade bodies in endothelial cells and is mediated by histamine, while E-selectin is induced by pro-inflammatory cytokines like TNF and IL-1. These selectins bind to specific carbohydrate molecules, such as sialo-Lewis X, on the surface of leukocytes, initiating a rolling motion of leukocytes along the vessel wall. Following the rolling stage, leukocytes firmly adhere to the endothelial cells via cellular adhesion molecules, CAMs, and integrins. TNF and IL-1 upregulate CAMs, ICAM and VCAM, on the endothelium, while C5a and LTB4 stimulate the expression of integrins on leukocytes. Interaction between CAMs and integrins leads to the firm adhesion of leukocytes to the vessel wall, facilitating their subsequent transmigration across the endothelium and into the tissues. Once in the tissues, neutrophils move towards chemical attractants, such as bacterial products, interleukin-8, IL-8, C5a, and LTB4, in a process known as chemotaxis. This directed migration helps to concentrate the immune cells at the site of inflammation, enabling them to efficiently combat pathogens and clear cellular debris. Once neutrophils reach the site of inflammation, they perform a crucial function in the immune response, phagocytosis. Neutrophils engulf and internalize pathogens, cellular debris, and other foreign substances through the formation of pseudopods, which extend from the cell surface to enclose the target material. The internalized vesicles, known as phagosomes, then merge with lysosomes, forming phagolysosomes. Within these phagolysosomes, the pathogens and debris are broken down and destroyed by various enzymes, including lysozyme, in a process known as intracellular killing. An efficient process known as the oxidative burst plays a significant role in neutrophil-mediated intracellular killing. During the oxidative burst, the enzyme NADPH oxidase converts oxygen, O2, to superoxide anion, O2, within the phagolysosomes. This superoxide anion is then converted to hydrogen peroxide, H2O2, by superoxide dismutase, SOD. Myeloperoxidase, MPO, another enzyme present in phagolysosomes, converts hydrogen peroxide to hypochlorous acid, HOCl, also known as bleach, which is a potent antimicrobial agent. The oxidative burst and subsequent generation of reactive oxygen species, ROS, contribute to the destruction of engulfed pathogens, enhancing the immune response against infections.
Defects in the oxidative burst can lead to various immunodeficiencies.
One such condition is chronic granulomatous disease, CGD, which is characterized by a genetic defect in NADPH oxidase, resulting in impaired production of ROS and a decreased ability to kill certain pathogens. CGD patients are particularly susceptible to recurrent infections caused by catalase-positive organisms, including Staphylococcus aureus, Pseudomonas cepacia, Serratia marcescens, Nocardia, and Aspergillus. Beyond the oxidative burst, neutrophils also employ O2-independent mechanisms for killing pathogens. Neutrophil secondary granules contain enzymes like lysozyme, elastase, and major basic protein, which play a role in the destruction of pathogens. Macrophages, another essential group of immune cells involved in inflammation, come into play once neutrophils have fulfilled their role. Macrophages are derived from monocytes circulating in the blood and predominate after neutrophils, peaking in number 2 to 3 days after the onset of inflammation. Similar to neutrophils, macrophages can perform phagocytosis, ingesting and destroying pathogens and cellular debris. They also play a central role in managing the subsequent steps of the inflammatory process, determining the outcome of the inflammatory response. Macrophages have a diverse array of functions, ranging from promoting resolution and healing to mediating chronic inflammation or abscess formation. Their activity is tightly regulated by various factors, including anti-inflammatory cytokines like interleukin-10, IL-10, and transforming growth factor beta, TGF-beta, which promote resolution and healing. Macrophages can also continue to produce IL-8, a chemokine that attracts neutrophils, leading to the persistence of acute inflammation.
In cases where the inflammatory response is unable to clear the pathogen, abscess formation may occur, involving the formation of a localized collection of pus surrounded by fibrosis. Macrophages play a role in mediating fibrosis by releasing fibrogenic growth factors and cytokines, which contribute to the formation of scar tissue and the containment of the infection. In situations where the inflammatory response persists and becomes chronic, macrophages are central to the process. Macrophages act as antigen-presenting cells, capturing and processing antigens to activate CD4+ helper T cells. These activated T cells, in turn, secrete cytokines that further amplify the inflammatory response, leading to a sustained and chronic state of inflammation. Chronic inflammation is often associated with various diseases, including rheumatoid arthritis, inflammatory bowel disease, and atherosclerosis. In conclusion, inflammation is a complex and essential process in the body's immune response to infection and injury. Acute inflammation is characterized by its rapid onset, involving various mediators such as TLRs, arachidonic acid metabolites, mast cells, complement, and Hagemann factor. The cardinal signs of inflammation, including redness, warmth, swelling, pain, and fever, are manifestations of the underlying inflammatory process and are crucial in initiating the immune response. Neutrophils play a pivotal role in the early stages of inflammation, executing essential functions like margination, rolling, adhesion, transmigration, chemotaxis, phagocytosis, and intracellular killing. Macrophages follow neutrophils in the inflammatory response, taking on a broader role in determining the outcome of inflammation. They can promote resolution and healing, maintain acute inflammation, initiate abscess formation, or mediate chronic inflammation. A comprehensive understanding of the complex mechanisms and mediators involved in inflammation is crucial for developing effective therapeutic strategies to manage inflammatory conditions and promote tissue repair. Thank you for watching, and be sure to talk to your healthcare provider if you have any questions or concerns about your medications and any health conditions you may have. Disclaimer: the information presented in this video is for educational and informational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition.
Never disregard professional medical advice or delay in seeking it because of something you have heard or seen in this video. We would like to express our gratitude to our sponsor, First Cup Coffee, the original seed, for making this video possible. Shop firstcupcoffeeusa.com. First Cup Coffee, the original seed, is dedicated to providing high-quality coffee that fuels your studies and work with a rich and invigorating taste. We appreciate their support in bringing you valuable, free educational content. Remember to visit firstcupcoffeeusa.com for your daily dose of exceptional coffee. That's a wrap for today's lesson. I hope you found this video informative and helpful. If you have any questions or topics you'd like us to cover, let us know in the comments below. Don't forget to like and subscribe to our channel for more educational content. Take care, keep studying, and I'll catch you in the next video. Bye.